It's time for Catching Up with Carley, presented by Meijer. And today I'm joined by Dr. Johnston Klamerus to kick off Breast Cancer Awareness Month. How's it going, Dr. Klamerus? What have you been up to?
Good afternoon, Carly. Everything is going very well in these turbulent times. Thank you for bringing attention to a very important cause in breast cancer awareness and all the community service that your organization does.
Thank you so much for taking the time out to talk with us. Can you tell us a little bit about your background and current responsibilities at Karmanos?
Sure. I am a medical oncologist, which means my specialty is actually the chemotherapy portion of cancer treatment. Medical oncologists also, in general, oversee the general care of someone, a patient who is on a cancer journey. I however, do not currently see patients. I'm the president of the Karmanos Cancer Center and our statewide network, which includes 16 cancer facilities here located in the state of Michigan.
Wonderful. Okay, so let's talk about the importance of getting early detection in the fight against cancer. Why is it so important to get that early detection?
Uh, Cancer falls into a bucket of illnesses for many Americans that is actually a preventable disease. That is through the right actions, through the behaviors, health behaviors, as well as attempts for towards prevention, screening and early detection, that we can actually make a major difference in the outcomes of cancer for most Americans. In 2020, the American Cancer Society projected that nearly 1.8 million Americans would be diagnosed with cancer this year, a number that's just staggering to think of. Roughly 60,000 here in Michigan. So many of those cancers are preventable if we adopt the right lifestyle behaviors, and certainly in the case that you're featuring today with early detection and screening, if we follow the recommendation and the guidelines for the age-appropriate screening that will help decrease our risk. Because in cancer, if we can find the disease early, oftentimes we get much better outcomes for patients. And in the case of breast cancer, we can cure upwards of 90% of people diagnosed with the disease if caught early.
Wow, so that early detection is key. So what kind of cancer screenings are available?
Yeah, broadly speaking, they certainly have changed over time as evidence mounts and is reviewed in terms of the overall benefit of early detection tests. But when we think of cancer screening in general, of course, mammograms, as we've already mentioned, for men and women of certain risk profiles, but certainly as we think of the population, mainly for women. Colonoscopies for early detection of colon cancer for individuals over the age of 45, unless there's a family history. Also cervical cancer, an important test for women, along with early preventative strategies like the HPV vaccine for both girls and boys to decrease the risk of the human papillomavirus induced infections, and then also secondary cancers. And fortunately today, we also have lung cancer screening available for identifying lung cancer when it can be diagnosed at an early stage and hopefully treated and possibly even cured for some patients. We also know there's important considerations for screening for skin cancer, in particular people who have certain risk factors. And one that we don't hear a lot about is oral cavity, head and neck cancers. And certainly this is one area we just finished, we're finishing the month of September. Prostate cancer is something that historically men had always received PSA tests for. Over time, that has been determined to actually not have a survival benefit for men, but certainly individual men of high-risk backgrounds with their primary care physician, with the urologist or oncologist, should consider that screening in certain circumstances. But that's the general broad array of screening. And I think it's worth pointing out, we mentioned before coming on today, some of the challenges of our time as we're seeing with the coronavirus and COVID. Across the United States, we are seeing a decrease in the usage of cancer screening. A study I saw last week had mammograms down by 92% in the United States. And those are real women walking around with breast cancer that haven't been diagnosed because of concerns of engaging with the healthcare system during COVID. So especially this year, if we're going to continue our forward progress to reduce cancer mortality, we have to keep the screenings moving forward.
Wow, that is a staggering stat to hear. Hopefully, with October being Breast Cancer Month, that'll bring more men and women in to get screened. Now, let me ask you, who should be screened for cancer?
It's a very difficult question, and the reason it's difficult is because it has a very individualized answer. And I think it's important for all patients, all your listeners, to think about what the individual's risk factor is for cancer. If you have had a family member with a cancer, multiple cancers, especially at a young age, you need to talk to your primary care physician, your health provider, about when is the age appropriate time for you to initiate screening. But in general, the guidelines for the screenings that we talked about, mammographies should begin or should be offered at the age of 45. And various recommending bodies adjust that time. We recommend annually after the age of 45 for breast cancer and mammograms. For colon cancer, actually, the American Cancer Society recently decreased the age from 50 to 45 years of age at the time of the first screening. And then colonoscopies, as long as they're normal, that goes on every 10 years. But again, that's adjusted for individuals based on their family risk factors, as well as what the colonoscopy may show. And then we know certainly for cervical cancer, that's usually an annual exam for most women. And then based on your overall sexual health and sexual activity, the frequency of those testings can also change over time. So unfortunately, I wish I could give you a quick answer, but it is highly individualized. What I would recommend is anyone with any of your listeners who may have questions to either go to Karmanos.org or the American Cancer Society, where all this information is freely available to the public to review.
Okay, so now what is the benefit? Another broad question. What is the benefit of being seen by an expert at Karmanos Cancer Institute?
Like one of the things that we're very proud about in our work at Karmanos is it's all we do. You can go to a general service hospital and you'll see a specialist that is involved with colleagues that do lots of different things. At Karmanos, it is our only focus. We are Michigan's only dedicated cancer hospital. We're one of two comprehensive cancer centers designated by the National Cancer Institute. And although our main treatment locations, our headquarters are in Detroit, we have satellites throughout the state, including in the metro area in Farmington Hills, in Mount Clemens, in Pontiac, many other areas that patients can access us. But the importance of being seen by people who only do this work is it's our daily focus. Every employee who comes to work at Karmanos, this is the calling of the work that we do. And if you do face cancer treatment or a diagnosis in your life, patients tell me every day the difference that makes by having specialists who are focused just on that. What it also means in terms of access to cutting edge treatment for patients is that we have, through clinical trials and research, access to the latest and greatest therapies. Approximately 50% of all new cancer drugs are tested at Karmanos before they are commercially available and available to the general public. So having that expertise, having that commitment and that passion is a part of our work every day. And for those of us, or for those who need that care, we're proud to be here of service for our patients.
Beautiful. Okay, now what should one do if they need a cancer screening?
I think it starts importantly with discussion with your primary care provider, but certainly through benefits such as the Affordable Care Act that was passed during the Obama administration, we all have the right to have cancer screening. No health insurance plan can prevent that. The state Medicaid program for patients even allow access for patients to get this broadly. So you have a right for cancer screening. Those resources I mentioned, the American Cancer Society and Karmanos.org, there's information there of how to call and get access. Certainly if patients are hoping for treatment at our facilities, our phone number is easy to remember. It's 1-800-Karmanos, Karmanos, and you'll be in touch with one of our navigators who can help you with your particular questions about cancer screening.
Outstanding. Dr. Klamerus, thank you so much for taking the time to join me on Catching Up
Thank you,
with Carley,
Carley.
presented by Meijer. This has been very informative, and I really hope those staggering stats will change within this month.
Thank you for helping us bring attention.
Absolutely. We appreciate it. Daniela, back to you.